Hey everyone. Wow. I just realized how bad my hair looks. Um, First, before anything else, I'm going to make this little disclaimer. I have no idea what might happen during this video, what interruption might occur. I apologize in advance because this is now my 7th time sitting down to do this video. And it's probably about a week and a half late. Compared to when I wanted to get it up, when everyone was putting in requests for it, but I knew I was going home last weekend, and I was like, oh, I can grab my binders, because I left all of those at home, and I forgot them, so they're still all at home, at my parents' house. So what I did is, thankfully I had all those notes still on my computer, so I just went ahead and printed off the notes that I was trying to get, and I'm just going to make do with what I have, but every time I sit down to do this video, something interrupts. I literally, like an hour ago, sat down to make this video for you guys, and my boyfriend was out, like, working, putting new brakes and brake pad cylinders and stuff on his truck, and I had just hit record, and he walked in and was like, hey, can you take me to Lowe's? And before that, this morning when I sat down to do this video for, like, the 5th time, he was like, hey, I'm going to go to the auto store. Do you want to go get lunch? I was like, okay. So hopefully this time I can get through the whole video, get you this information before any other interruptions. So this video, I had like 4 or 5 people request this video, and this video is going to be all about how I studied for nursing, Med-Surg nursing, and for pharmacology. And really my studies for each school category was similar, so there's not a lot of variance, but there is some variance between class to class. Also, the next thing I want to do is address the Hurricane Irma. I know a lot of you guys who watch are in like the Florida area, or you go to the same school, but you're in the Florida area, and that's kind of how you found me, or whatever the case may be. Some of you don't live in Florida and you have family in Florida, so my first thing I want to say is, I'm praying for all of you, for all of your safety with Hurricane Irma coming. They just announced this morning that, not even this morning, early afternoon, that I was just leaving Cuba, so it's coming, and it's coming right for Florida, and I feel for all of you guys on the East and West Coast, especially on the West Coast. My whole family is just north of Tampa, near the Ocala area, right where the eye is supposed to go over. So it is not scary. Yes, hurricanes are scary. They've never really scared me because I never lived in an area that really flooded, but they're talking 120-mile-an-hour winds even up there. So I'm praying for everyone. I hope you all are safe. If you evacuated, you got out and you're at a safe, area. If you have family down there in Florida, I'm praying for your family. I hope everyone is safe. I hope that this storm causes no more casualties after it completely decimated the Caribbean. It's just so sad. I watch the news and I just want to cry, like seeing all the devastation. And then the other part of me, I was telling my boyfriend, was like, I just want to go and help. And I've gotten 3 emails from Florida Health about needing nurses. So I'm going to talk to my work later about taking some time off and going down there if there's after the storm for the need. I know the last one I got last night this morning at 4 a.m. was for, nurses for shelters and special needs shelters and stuff. But honestly, at this point, it's too late for me to head that direction, so we're just waiting until afterwards. And then just going in, and I just want to go and help, so I feel bad for them. Like, I've been there. I understand kind of what it's like. I know my home county floods so easily, the part that's right by the water. So I'm praying for them. So far here in Pensacola area, we are safe. It is a little more scary this time because Pensacola floods with a summer rain shower, so the amount of water this hurricane could dump on us is ridiculous. I'm still waiting for my work, depending on how it goes. As a nurse, I'm considered a first responder, so I will have to report to that hospital and stay there for anywhere between 72 and 96 hours as Team A, and then Team B will come and relieve us. But so far we haven't gotten called out, knock on wood. Hopefully we won't have to. My boyfriend is in the Navy. I think I've mentioned that before, so he may be, mandatory evacuation. We're not sure yet. They did send him a message this morning saying, just have a plan in place in case, but we'll let you know further if you guys have to. So, we're not completely out of the woods. We're still we've just started getting 15-mile-an-hour winds, gusts, not sustained winds even, just gusts. So it is a huge storm and very scary. And I know it's on a lot of our minds and hearts right now, and especially for those of you who have evacuated. So I'm praying for you guys, and I'm praying for everyone in Florida. Myself, everyone here, but especially down south. It's not something to take lightly, and I hope that those of you who are in evacuation zones have evacuated and you've taken those seriously if need be. But anyhow, I'm new scenery here. Sitting on my couch because every time I try and set up the table to get this done, stuff happens. So let's get into the video now, and hopefully this won't be a super long video for you guys, but I do want to cover some important topics and highlights here. So I'm going to start with my pharmacology information first. So first of all, these were the textbooks that we used for pharmacology in my program that I still have. I'm starting to sell a lot of my textbooks that I don't see necessary to keep a hold of anymore, but thankfully for this video I still have the textbooks required for it. So this was our pharmacology textbook that we have. It's the Focus on Nursing Pharmacology Amy Karch, 6th edition. As far as textbook go, really, it's a pharmacology textbook. Wasn't necessarily one of my favorites. That might have also been because of the teacher I had that I wasn't, thrilled about how she taught, because she really didn't teach us, so it was more of a teach-yourself kind of class, but that was helpful because from a studying aspect, I had to depend on myself to study and get the information, so it was a lot more rigorous of a studying habit session, if that makes sense. But it talks in here. There's not really much to tell you about this. I just basically read through the chapters that were required. Some of the areas I would skim over. I took some basic notes, and then just used it to look back for studying if there was topics that I wasn't firm on, to kind of read them again. Otherwise, I just went and looked up videos for it online. Really wasn't super helpful, but this I thought was very helpful, and it's the Focus on Pharmacology study guide that matches the book. I got mine as a set. I was looking it up online the other day, and it wasn't sold as a set anymore. It was sold individually, which I thought was weird, but mine came as a set, and it came with this study guide, and I think I wrote on a couple pages, and then I stopped writing on them and started writing on just notebook paper, so I could sell it again if I wanted to, or go back and do them again just so that the answers weren't written there, and I'm it makes it harder to study when the answers are already answered for you. Does that make sense? But this, honestly, loved this. And I know that sounds weird, hey, it's the same thing as the book, but no, I loved this because it made it a little fun. So I would spend hours studying for each class. And that's my family asking if I'm evacuating. It's the same thing, how can you love one and hate the other? Let me just show you. Okay, so this book, first of all, has a lot of words and stuff, and I get that it's pharmacology, it's not going to have graphs, it's not going to have charts, it has some, but for the most part it's words and breaking it down, and it's it's hard to get through. It's hard to sit there and take all of that information in. So what I did was I went through and I read this and I took basic notes on this information here. I went through the resources that were provided from the class and what we needed to know. And then once I had studied those, looked over my notes, read through my notes, I went to the study guide. And I did this for each chapter. So I would read this part of the chapter. I would read the chapter. And then I would come here and let's go to Chapter 3, Toxic Effects of Drugs. So what it does is it takes all the information from the book and puts it here in like quiz form. But it's not just regular quizzes, which I kind of liked. I mean, it's got like learning objectives, it's got short answers, it's got matching questions. Select the description from column 2 that best describes the term in column 1, anaphylactic reaction, cytotoxic reaction, serum sickness reaction, and delayed allergic reaction. And then you find the answers over here and match them to those matching parts of it. Let me see. Some of them had like crossword puzzles using like, oh here, see, there's a crossword where the definitions are here and you have to figure out what the term is that they're referring to. So like I would answer these on a notebook paper and then I would go back and see how many I got right, in these individual quizzes. There's more matching, like it was kind of like puzzle kind of things, different ways of studying. They had like NCLEX style questions for the same topics. But once I did that, after I finished reading, I would do these, and then I would go through and I would read through the notes from my teacher, notes from the classes. I would read through my notes, make sure, really study the information, make sure I had an understanding, and then I would go through the answers I got wrong taking this the first time without reading through that, just looking at my paper. Once I was grading, I would write, I got this on corticosteroids wrong maybe. So then I would spend a little more time making sure I really knew that information, and then I would go back through the day before the test and I would redo the questions for the corresponding chapters in this book to really make sure that I had an understanding of the information that was going to be on each individual test. And that I found was really helpful. I think on all of my pharmacology exams, pharmacology was a struggle, but I got B's or A's on all of my pharmacology exams. I think the lowest was like an 85 or something like that. So I found that very helpful for pharmacology. Pharmacology is a beast. Like, it is no joke, it is a beast. Definitely recommend finding some kind of nurse's like pocket study guide. I was going to show you guys mine, but it's in my nursing bag, which is in my trunk in case I got called for the hurricane. I'd like packed up everything just in case. And I don't want to stop this to go get it. But finding a good like nurse's pocket drug guide, definitely recommend that. It'll come in super handy, especially for the class, but also for when you're getting into clinicals, when you're in your preceptorship, when you're in your career and you've got it like, because there are still drugs that I see in the hospital. I'm like, I've never seen this drug in my life. Like, don't know anything. And I can sit there and like read real quick a synopsis of what it is, the reactions, and then I can inform my patient, because the likelihood if I've never heard it and they're a patient that's just being admitted, they're not going to know what it is either. Especially since at the hospital, usually the drugs you take at the hospital are different than the ones that they take at home, because they're like the off-brand. They're the generic brand, not the regular brand that they're used to. So textbook-wise, that's what I did. And then for study guides, this is not the whole Pharm 2 study guide. I could have printed it all off, but the pharmacology one was like 22 pages, and I know I've already got it printed at home somewhere. I just forgot to get it when I was at home last weekend. So I just printed off like 4 pages that I thought would be helpful. But this is kind of what my notes look like to a degree. Can you see that? I know it's kind of blurry, but here, maybe that's better. But basically for pharmacology, I did several different approaches. So what I did here was I put corticosteroids, and then I put the basics of it. So glucocorticoids, mineral corticoids, androgen, and whatever. I can't pronounce, okay? I have a struggle pronouncing some of these. And then I explained. So I explained what the adrenal medulla was, because it interacts with corticosteroids, the sympathetic nervous system, norepinephrine, and all that. Then I went into adrenal cortex, and then I went into diurnal rhythm, hormone cycle, adrenal insufficiency, and then because on our exams a lot of times they would ask, like, how does it relate to other cultures? So anytime there was something about another culture in the book, I made sure I took notes on it. So this one went on about African Americans and how they have an increased risk of toxicity to corticosteroids, especially methylprednisolone. And so I would take those notes here. So, like for African Americans, I put develop increased toxicity, and I had increased toxicity highlighted so that immediately I'd think corticosteroids, African Americans, increased toxicity. Because most likely that's going to be somewhere on one of my tests or quizzes or something like that. So increased toxicity to corticosteroid methylprednisolone. I spelled it. Oh, I did spell it right. Particularly when used for immunosuppression after renal transplantation. This toxicity can include severe steroid-induced diabetes mellitus. Steroid-induced diabetes can be permanent. Stopping abruptly will cause steroid withdrawal symptoms, such as steroid insufficiency. And African Americans are almost 4 times as likely as whites to develop end-stage renal disease, so this complication isn't an unusual problem. Take extreme care. So just kind of like little synopses like that to remind me so that if I saw it on the test, it was like straight in my head. African Americans increased toxicity with steroids 4 times higher than whites, whatever. So I went into each one of those, and then I have another, like, I went into, like, the nursing considerations. Then I put here steroids, things to watch out for. So things that steroids can cause: hypertension, hyperglycemia. Take steroids in the morning, give with breakfast due to the insomnia. You want to give them in the morning and not at night, so then they're not up all night. Sodium retention or edema, hypokalemia, give with food to prevent gastric irritation. Carafate may help prevent ulcers. Don't take with NSAIDs. It doubles the COX-1, COX-2, COX-3 blockade, which you'll learn more in pharmacology if not. GI bleed is a risk, so counsel to report black tarry stools. Depression and agitation. Sorry, my computer's doing something funky. So anyhow, I went into that, and then I go into prednisone, just to know each individual drug. So that was how and that's kind of how I broke that down, if you can see it. And then there were some categories where I had to do, like, a little bit different. See, I did adverse drug-to-drug nursing administration, nursing assessment, patient education. Then I went, into the next one and did kind of the same thing, of what to do, what you needed to know, things you needed to make sure you told them so that they didn't take the drugs and end up with an adverse reaction and all that stuff. So that's really how I studied for pharmacology. Pharmacology, it's a beast. I mean, I think I cried every single day for the first, 3-4 weeks of that semester because it was rough. It's just rough, and you feel like you're not understanding anything, and you got to find what works for you. Because it's crazy. It just really is. And then how I studied for the final exam is each exam I made those study guides, and those study guides would be anywhere from 15 to 20 pages, ridiculous. So for the final exam, we added new information. So what I would do is I would review those study guides rather than all of my notes every time. I would just review those study guides every couple days so that I wasn't losing that old information. Especially in pharmacology where it builds on each other, you really got to stay up and sharp on that information. So I would review those, and then for the final exam, I took the new information and added that, and then really kind of just focused on that because a lot of the stuff beforehand I knew. Something else that I would do on the pharmacology exams as well as other exams is after the test, questions that I got wrong, I would jot down the topics. So that, and I did this on all, not just pharmacology, so that then I would know as soon as I came out of the test, I'd jotted down the things that I remembered so I could go home and study them more, but also look at that information for the final exam. So I wasn't missing the same questions over again or the same style questions over again. That seemed to really help me too. And then just bouncing it off of other people, like, hey, there was this question on the test. Do you remember what the answer was? So then I had an idea to go back and look it up and better understand, what I was missing, and study for the final. I mean, really, that's all I did. And I did that a lot for all of my classes. That's kind of how I studied. And it seemed to work for me, but it takes a lot of time, a lot of dedication. I was studying a lot in school. I was saying no to a lot of parties and a lot of family get-togethers and baby showers, or if I did go, limiting my time. But you just have to find what works for you, and it's hard. So let's move on to MedSurg. So I don't know how everyone else has it, but my MedSurg was broken down into 3 MedSurg classes. So I had 3 MedSurg classes. So it was Nursing 1, Nursing 2, and Nursing 3, each in different semesters. And they broke the information up, so we eventually ended up going through our whole book, but this is our book. I mean, granted, it's big, and I've got folded pages here for some reason. But throughout the 3 classes, we eventually went through this whole entire book. So it was kind of broken up in a sense, but I studied pretty much the same way for each one. Our teachers, let me think. Yeah, all 3 of my nursing med-surg teachers handed out slideshow PowerPoints of whatever they had. So they would send that out, the day before, and I would go to school early the next morning if I could, print out those PowerPoints with the wording on the side, and I don't have any here to show you, or I would. Print out with the lines on the side, so I would do 3 on a page. Sometimes I do it front and back just to save paper, and because it gets to a point that I was carrying around 2 3-inch binders that were packed full of papers, and it's heavy on top of the books that you have to carry. But I print those PowerPoints out with the word, the area you can write on the side, and I would take notes. So I would highlight certain things on the PowerPoint that maybe they focused on hard, and I would star them, and then I would take my notes on the side so that my notes were right there with the PowerPoint. And then I didn't have to go back and type it all up. So that's one way that I studied, but this is the book that we used. And it's Contemporary Med-Surg Nursing, Medical Surgical Nursing. The second edition, it's Rick Daniels and Leslie Nichol. I use this right now for my BSN program because my BSN program is all online. And so a lot of our research and study materials for our papers are through peer-reviewed articles and stuff. But there's still things that you want to define something and you want something scholarly or not accredited. Anyhow, something that has good backing. It's not WebMD. And so I use this. And I cite it on my papers and everything. Sorry for bouncing around. It's sitting on my stool, so every time I move, it moves. But anyhow, I use this book. Love it. This is definitely a book that I'm going to be holding on to for my career because I really like this one. It's so helpful. It breaks down everything. It has graphs and pictures, and detailed pictures. Let me see here. Oh, that's vascular. Let's find something else. Everything is very easy to understand. It's broken down into great pieces. It has real life pictures versus it has other pictures, but it has real life pictures on different procedures and stuff. So you see an actual versus a cartoon drawing, I guess you call it. It's got uncovering the evidence things. It's got classifications of lipids and charts. It's got case studies in it. I really like this book. So I use it, and I use it for when I'm trying to define something or go more in depth. Got NCLEX style questions I can use. I'm trying to find a good page. That's kind of cool. Cardiac, okay. So see here, it's got a chart on the cardiac alarms for false high rate, QRS complex, how to use the QRS. It's got there. It's got pictures of the heart. It's got little graphs here of like a QRS EKG wave. And then it goes into like each individual section, the PR interval, QRS complex, QRS interval, T wave, QT interval, and explaining it there. It's got different examples of EKGs for the different rhythms that you can look at so you see them. It's got step-by-step on how to do certain procedures at some points. Hanging blood. It's a great tool, great resource, something that I think will come in handy later on in my career that obviously I'm still using for my BSN program, so it has been helpful. So this is something that I'm definitely going to hold on to, but this is the book that I used for my medical surgical classes, or nursing 1, 2, and 3 was what they called it in ours, but it was MedSurg. And then as far as notes, these are my just examples of my notes. Like I said, I didn't want to print out the whole thing. I keep almost knocking that over. So this was our second test, I think it was. No, it must have been our third test because it's week 7. Third test. So we were talking about immunity. So I used this graph kind of to define out immunity, to just show immunity, and then I went into each different category, kind of explained it. So type 1 release of IgE antibodies, cellular release of histamine. But then we also talked about like reactions of allergic reactions and things that you might come across. So there's urticaria, pediculosis, or lice. Urticaria is hives, so I go into the types, the signs and symptoms. I kind of bullet point them, do the basic information. Here goes into more information. This was a great page to print out, Jessica. So it says main complaint, pruritus or itching. Clothing needs to be ironed along each seam. Bedding, head coverings, brushes, combs must be dry cleaned or washed in hot soapy water. The treatment is 1% permethrin lotion for 10 minutes after pre-treatment shampoo. Benzyl alcohol, 5% lotion, 6 meters or older. I don't know what that was. Other less effective treatments are pyrethrin or RID, which is the stuff you can buy, I think, at Walmart or whatever. This is a great thing to pick out. It's really funny, actually, since one of our patients in the hospital has lice right now. So I made these out in kind of like bullet points for this class just because I wanted the core information and then just bullet points on the treatment plan, what it was, signs and symptoms, things that maybe you need to tell your patient at the time. So then it goes into scabies, highly contagious pruritic skin infection caused by a mite. It occurs in crowded sleeping areas, close personal contact with the mite through sharing inanimate objects such as clothing, bed, stuffed animals, mostly in schools and skilled nursing facilities. Treatment, tropical cream, vacuum all hard surfaces, empty debris in a sealed bag. All this stuff, that kind of thing, where I went into the treatments, and I just kind of did it like bullet points here, and I'll show you. Just bullet pointed the information for the whole thing, just the main stuff, stuff that I thought were going to be on exam, stuff that would help me understand and get it down, and remember the information when it came to the test. And then I just kept going over the information over and over and over again until the test and studying it. I got in small groups for tests and study with small groups. I didn't spend a lot of time studying in groups because a lot of times you get into that chit-chatty and people are talking and it's hard to focus. So a lot of my studying I did on my own, and then once I was ready I went and did a group, and I tried to keep the group focused so that we were going. But that's how I took my notes and the books that I used for my classes. And like I said, that's just what I found was good for me. This is another study that I found for my nursing class. I think this was nursing 2. Acute pancreatitis. I think this was nursing 2. Yeah, this was nursing 2. So this is like in the middle of the study guide, but you get the picture. So for this one, we were doing gastrointestinal disorders. So I basically went through, and on my paper, I wrote out, they would give us study reviews, like study this topic. So in dark black, I have here the topics that they would tell me to study. Not all teachers told us ahead of time what to study. So in dark black, I would have here what they told us to study. And then I would bullet like high information underneath it of what I needed to know and a little bit about that. So I did this. So we have overview of the anatomy. So you have the stomach, small intestine, large intestine, liver, and pancreas. I did basic information about each one. So pancreas secretes insulin and glucagon. Liver produces bile, stores vitamin B12, fat-soluble vitamins. So GERD is the backward movement of stomach contents in the esophagus. Symptoms of it: don't eat within 2 hours of lying down or after eating. Peptic ulcer disease. Went into the difference between gastric and duodenal ulcers. And I mean, it's just right here. It's just brief information on the thing to help me keep in mind the difference between A and B and the difference between what each one is. So that's what I did for all of these: IBS, chronic inflammatory bowel disease, diverticulitis, cholecystitis, acute pancreatitis, and took notes that way. And then we went into chapter 32, which was intravenous therapy. So hydrating IV solutions. You have isotonic, hypotonic, and hypertonic. What the different solutions are, an example of them, when they're used. Because we touched hard on that. And then I went into the intravenous infusions. You have peripheral central complications of IVs, such as infection, air embolism, hypersensitivity, circulatory infiltration, phlebitis. Did little bullet points on each one of those to help me understand those. CVADs, central venous access devices. We also touched on, this is that test that we touched on, electrolytes. And it was heavy on the electrolytes. I just printed, I think, 1 page or 2 pages of this. But how I did that was I just went into, this is the electrolyte, the normal level range. So for hypokalemia, normal is 0.5 to 5.5. I put causes, symptoms, foods that are high in potassium, if it's not fixed, what it can lead to. And I just did that for each one. Hypocalcemia is increased phosphorus and decreased calcium. So you can look at those levels and see, where are they at. Symptoms to look for. I did that for both hyper and hypo for each electrolyte. Ooh, the one's cooking up. Here it is again. And then we got into the acid base, so I started going into respiratory alkalosis and giving little examples about that and how the differences are and how to keep those separate. I mean, this is really how I studied for nursing 1, 2, and 3 is through short little snippets of bullet point information, because honestly you're not going to be able to write down everything about the topic that you're studying, because if you do that you're not going to have time to actually study. And that's what is crucial to understanding this information, is studying the information, actually having the time to dedicate towards studying. So yes, you want to take notes, but you don't want to take notes that are a paragraph long unless it's something you don't understand, because at that point you're not retaining any information because you're not having the time to study the information. So I did little bullet points that would remind me, and then, as I was in my group, I'd ask questions more in depth to try and get that broader understanding and scope of what it's talking about and what I need to know. So that's really it just sounds, I know it doesn't sound like I gave much help, but that's just how I studied for the exams. Really, it was just creating these study guides and bullet point formats and just getting the information that I was weak on or didn't know and studying those, and then quizzing myself and getting in small groups and testing and seeing, how much I really knew before the exam, so that I had, a day or two before the exam to really start studying the stuff I didn't know or wasn't confident in. But that's how I studied for pharmacology and MedSurg, and really that's how I studied for a lot of the classes. Some classes were different, as, I was either in the early stages developing how I was studying or what was best for me to study versus, the end on this worked for me. But really it was taking those notes and memorizing the information and getting an understanding for it and testing and quizzing myself. And I used Quizlet and Study Blue a lot, and I would take those and, you know, we had a class group that we created, and so we would all put in our notes and stuff, and just taking those because you can turn them into flashcards right there on the app. And when I'm out at like restaurants or waiting on classes to start, like flipping through those, because it keeps track of ones you get right and wrong, and it'll re-ask you questions you get wrong or that you're weak on. So I use that a lot too, just to study and really get that foundation and that understanding of certain topics down. I mean, other than that's really how I studied for those. And hopefully this video was helpful for you, especially those of you who were requesting it. If you have any other questions, please feel free to comment below. I'm more than happy to take the time and try and answer those as much as I can, and maybe clear some things up. If you guys have any questions at all, please let me know. If you guys have any other video ideas, I'd love to hear some. Love to hear, you know, how you guys are doing. Again, I hope everyone's staying safe during this storm. And I will talk to you hopefully soon, within the next week, you know, once Irma blows over and life kind of settles down again. Not that it settles down much, but I'll be making another video here very shortly, very soon. But if you have any ideas on video topics that you'd like to do, this is a really good idea, really great topic. Please feel free to let me know, and I'll try and incorporate those into one of my next few videos. So I will talk to you guys later. Thanks for tuning in and watching, and I hope this was able to help you guys in some way study for Med-Surg or Pharmacology. And again, I apologize for talking so fast, but I was trying to get this in before somebody interrupted me again. So I'll talk to you guys later. Stay safe and keep watching. Thanks.